While we wait for everybody?
They're coming. This is the permanent secretary, Ministry of Economic Planning.
Thank you for meeting us. Thank you.
And that's Director Planning for the Ministry of Economic Planning.
Nice to meet you.
And that's another director, technical assistant. And this is Aliu. He's on our team. He's a focal person for Ministry of Economic Planning. And of course, you met the director. Who is receiving them?
Thank you.
Yeah, you are welcome again. Thank you. You are welcome. You are welcome to Nigeria, to Gombe State. Yeah, you are welcome. You are welcome.
Hi, thank you.
Thank you.
This is everybody on our team.
Yes, this is Johnny. Johnny, this is the commissioner, this is the permanent secretary economic planning. You remember? Yeah, the commissioner for That's the commissioner for health. Mo, come and say hello.
Hi.
Hi, you're welcome.
That's the commissioner for health. This is the PS, economic planning. And these are directors. Director disease control, primary healthcare agency, directors, economic planning. So they are all very, very supportive. Thank you, sir, for coming. We just grab our bags and leave. Thank you very much, sir. Thank you. The CEO of the airport, who is the commissioner for economic planning. Yes, this is the engine where all the NGOs must relate and give report of their activities. And they have been at the forefront of everything that we're doing, getting the MOU signed, even to get this appointment, all the arrangements for the vehicles for my house, to his office. This is Jamie. You remember Jamie came to your office the other day? Yes. She came with Kali. And she's wearing, she was wearing a native attire that day. And this is Brian. And this is James. This is the director of communications. And that's Mo. She's struggling with her. Mo, don't worry. I'll do it for you. Let's go inside.
Don't worry, let's go inside, mommy.
Your Excellency, the Executive Governor of Gombe State, Alhaji Dr. Ibrahim Sandankombo, OON, Gombe, Your Excellency, the Deputy Governor, Honorable Commissioners here present, members of the State Executive Council, the Secretary to the State Government, the Head of the Gombe State Civil Service, the Chief of Staff Government House, Principal Officers and aides to His Excellency, Special Advisors, Special Assistants, Personal Assistants to His Excellency that are with us this morning, distinguished invited guests, especially our visitors this afternoon, we welcome you to the chambers of the Gombe State Government House. Your Excellency, as has always been our tradition, I would like to ask for your permission to invite the Permanent Secretary, Cabinet Secretariat, and his counterpart of General Duties to lead us with the opening words of prayer. Permanent Secretary, sir.
In Jesus' name, amen. Our divine King of glory, the greatest I am that I am, we thank you for a moment like this because it is your making. Appreciate you, Lord Father, for our August visitors, and we thank you, Lord Father, for all that is going to be, Lord Father, done here. We pray that, Lord, you guide your Excellency in all his endeavors, so that, Lord, all that will be done will be for the benefit of Gombe State and Nigeria as a whole. Accept our worship, Lord Father, to the glory and honor of your own name in Jesus' name. Amen.
Your Excellency, sir, straight into business this afternoon. Paying you a courtesy call is a joint delegation of team members from End Fund and also members from Amen Healthcare and Empowerment Foundation. Your Excellency, with your kind permission, may I start by introducing the team leader of the delegation in person of Mrs. Rita A. Aimu Oguntoyibo. She is the team leader of Amen Foundation, and also her counterpart, the CEO of End Fund, Mrs. Ellen Agla, CEO of the End Fund. Your Excellency, I have introduced her. I don't have the full list of the rest of the delegation, but I will crave the indulgence to do personal introduction so that you know who and who are part of the team that you are receiving this afternoon.
Thank you very much, Your Excellency. I am Rita Isai Aimu Oguntoyibo, the founder and president of our foundation.
Hello, my name is Ellen Agler, and I am the CEO of the End Fund. It's such a pleasure to be here, Your Excellency, and thank you so much for having us.
My name is Jamie Tallis, and I'm also with the End Fund.
My name is James Porter, and I'm also with the End Fund, and I have with me Maureen and Ryan, who are working with us to capture some of our programs while we're here in Gombe. Thank you so much for having us.
Well, yes, Your Excellency, I think the rest of the members of the team are well known to you. They are people here in Gombe. They have been here severally, led by the Honorable Commissioner, Permanent Secretaries, and other executives. Your Excellency, for the sake of expediency, I will not be introducing all of them, so permit me to quickly invite Mrs. Rita A. Amo for the presentation of the purpose of her visit this afternoon. Madam, you are welcome.
Your Excellency, the Executive Governor of Gombe State, Alhaji Ibrahim Sandankombo, Your Excellency, the Deputy Governor, the Honorable Commissioners and other members of the Executive, members of my team, End Fund and Amen Foundation. It gives me a great pleasure to be here, Your Excellency. Before I start my long story, because I know how long it's taken me to meet with you, I want to crave your indulgence to allow the CEO of the End Fund to say a few things before I start. Thank you so much, sir.
Well, it's a great pleasure to be here today. I was hoping that Rita spoke first so I could just say what she said. First of all, since I don't know everyone here, I just really want to personally thank each and every one of you who has been a part of the Neglected Tropical Disease Program. I wonder if I could just get a show of hands. Who has personally been involved in helping deliver medicines and support the Neglected Disease Program here? For us, just a huge round of applause. We really appreciate it. I have learned that over 2 million people in this community have received treatment for neglected tropical diseases. We fight here at the End Fund, fight every day to ensure that the over 1 billion people globally that are affected from the 5 diseases that we are focused on and receive treatment. And we know that without partners like the government and the community health workers, Med Health and others, this would not be possible. And I want to tell you a small personal story about a dream that's coming true for me today. When I was a small child, my parents used to take me to the Museum of African American Art at the Smithsonian in Washington, D.C. And I used to spend hours looking at art and photos from northern Nigeria when I was a small child. And I thought, I hope one day I get to go to northern Nigeria. And then I entered the world of global health, and I got to go to Latin America, and to the Middle East, and to Asia. And I thought, well, one day I'm going to go spend time in Nigeria, because I hear it's a great place for public health victories. And I heard about the work on maternal health gains, I heard about the work on the polio successes, and I studied about it when I was at Harvard working on public health, and I thought, okay, one of these days, Nigeria is going to be in my future. And so a few years ago, I got to go to Abuja, and I didn't actually leave the conference room in Abuja, and I thought, okay, this was very exciting to go to Abuja, but I did not feel like I really experienced Nigeria. So coming here, driving into Gombe, we received the most amazing welcome at the airport. I feel finally I have arrived in Nigeria, and it is truly a dream come true to be here today. So thank you so much for welcoming me. And also, it was our dream when we started the End Fund years ago that we wanted to find local partners, local NGOs. I think when we first started the End Fund and people heard we had funding to give for NTDs, we had a lot of large NGOs applying for money. We had the World Health Organization. We had a lot of big partners. And we said, we hope one day we can find some local partners that are led by people from the communities that really we can help build and support. And so when we found Amen, and others, and partners here in Gombe that did not have a lot of support, for us that was another dream that came true. And so I was just so happy to hear that Gombe really was looking for partners and was so open to not only receiving partners that might have been from another state, but also from other countries. And we're so open to saying this is how we can really improve the health of the world, is by coming together, all of us with the small gifts that we might have. I don't know this community, but I feel like we have people from all over the world that are so excited and are here to celebrate what we're doing today. So I just want to thank all of you for allowing us to participate, from learning from you. We're here to listen and to hear what you have done well here. We've heard incredible successes, and we've come here to see those firsthand and to listen to your stories and to return and share them with the others that we work in across other countries around the world. The End Fund is really proud that last year we supported organizations around the world to treat over 100 million people at risk of neglected diseases, and we've asked to do much more. And the stories from here in Gombe, you can be assured, will travel around the globe, and we're looking forward to continuing to support this work for many years to come. I know that we have been able to support with about $1 million for a 3-year initiative, and we hope that's just the beginning. For us, we have the name the End Fund in it, for ending neglected diseases, END, but also because we want to stick with you until the end, really until we see the end of these diseases, until we can get so no one suffers from the blindness of river blindness, so no one suffers from the blindness caused by advanced trachoma, that no one has to live with intestinal worms in their belly and not grow and prosper. And I think this is something that by working together, we can really accomplish. And so I hope that we don't do all the talking today, that we can really listen to you and we can hear your advice about how we can support you even better. So just looking forward to that today. Thank you so much.
Thank you very much. Your Excellency, it's a long story coming to Gombe State, and I think I crave your indulgence to tell you who I am, how we came about coming to Gombe State, what we have done, and what we plan to do in collaboration with your government. First, I would like to start by thanking you most sincerely. When we were thinking of coming and getting the end fund grant, we started thinking, where do we go? We needed a state that has a good government, a state that has a purposeful leadership. And I happened to have observed His Excellency from the day he entered into the state to declare his intention to be governor of this state. I was sitting in my office. By the way, I worked for WHO for 31 years. I retired in January 2016 at the age of 60. Just before then, I got the end fund grant to go. In fact, it was open. I could have gone anywhere. At the NGDOs, which is the NGOs dealing with NTDs and others, we have what we call the orphan states. And there are so many of them still in the southwest, in the southeast, and in the north. But I chose Gombe because, number one, I observed and I asked questions. You have a good leadership, you have a purposeful leadership, you have a governor that cares for his people. And that is demonstrated in the fact that in this country, where so many states are not paying salaries, not one person does not receive, not one person goes home without a salary every month, right? This is one state in this country that pays salaries every month. And this is part of the enabling environment that we have, that has enabled us to work. Because if you go to a state where people are not paid, they are not going to come to the field with you. So we came in November 2015, when we got the grant from the End Fund. They were very gracious because my foundation had never done NTD. What I did before now was 13 years ago when I wanted to mark my 20th year service in WHO. I wanted to throw a party as a negotiator. But something kept ministering to me, do something. Yes, I'm a negotiator. I was born in Lagos, brought up in Lagos. I wanted to throw a party to mark my 20 years because for me it was a feat. And then something kept ministering to me, go out there. You have been receiving these reports of people dying from preventable and curable diseases. What are you doing about it? Is it a party? And I said, yes, that's true. Maybe that was the Spirit of God talking to me. The next day, I went to my rep, the WHO rep. I said, WR, there's something I want to do. And he gave me the support. This was how AME Foundation started in 2004. And as a WHO staff, I could not solicit for funds. It will amount to conflict of interest. And so I had to sacrifice my holidays. I used to enjoy traveling a lot. I traveled 3-4 times a year. And I go from London to this and that. So I had to stop all that to save up money. And then I had support from 2 of my brothers, one in the US, one in the UK. This was how we were funding AME Foundation. And we started in Edo State because my parents originally came from Edo State. And at that time also, they were doing well in terms of healthcare in Lagos. That was the time of Bola Ahmed Asiwaju, who was doing surgeries on the streets. So I felt I needed to go back to my state. Charity should start at home, but it shouldn't end at home. So we started in Edo State, and we started by conducting, with the Nigerian Medical Association, we started by conducting free medical care for communities. you know that a lot of people are dying today because they don't know their health status, they don't know they're hypertensive, they don't know they're diabetic, and then suddenly they fall, they have a stroke, or they actually die instantly, and people attribute it to other things. I knew this was a major problem in our society. And then the first outing was an eye-opener. I saw surgeries. By 2005, I got doctors to start doing surgeries. I got the site savers to support me. The good luck I had was that all my years in WHO, I was very willing to help people, and so I enjoy a lot of goodwill. All the people that have come across me are so happy to support. So the site savers gave me medicines, they sent me doctors. We actually go to villages. We set up, we go into a hospital, clean it up, we screen people, and we do surgeries. And that is so exciting to me. You see a man leg blind, and then the next day he can see. You have revived his life. You have created him again. And that is one of the major things Amen Foundation was doing. And then, WHO many years ago had trained people for 5 African countries on a very simple method of preventing cervical cancer. It's so simple and cheap that you put a woman on the couch, you just drop acetic acid in the cervix, and you can see a woman that has precancerous cells. And those cells, in a few years, will develop to become cancer. And we all know that when cancer is full-blown, there's nothing we can do about it. So it is cheaper and better to nip it in the bud. But unfortunately, we were not doing anything with it. So I picked up the team and I said, come with me to Edo State. And in 2007, we did outreach. And it was so successful. The commissioners for health and women affairs started pleading with me that they don't want outreach. Please set up centers for us. By January 2008, I got my colleague in WHO to support us. We trained 78 doctors and nurses for Edo State. Unfortunately, Your Excellency, you know the issue of sustainability, especially when there's change of government. But I can tell you the good news is that the central hospital, which we as Amen Foundation adopted, I provided the cryo and everything for them to function. We were providing all the consumables. That center is functional today and is self-sustaining today. So, Your Excellency, this is another angle. For the NTDs, we came into the state immediately. In fact, before the End Fund gave us funds, as soon as I got a mail indicating that they were seriously considering, I flew into Gombe. When I came into Gombe, I had never been to Gombe. The only persons I knew in Gombe were my colleagues in WHO. And they came to meet me at the airport. They escorted me to the then permanent secretary. The then permanent secretary, Ministry of Health, I think he's somewhere there. I saw him just now. Yes, he was the then permanent secretary, Ministry of Health. I met with him. He told me you have to go to economic planning. I left from his office to economic planning and then to the primary healthcare agency. The very week that we got the funds, we were in Gombe. And the Federal Ministry of Health were not even ready for us because there was no allocation for us. But I told them, I'm moving. We have to start treating immediately. So they had to start mopping up drugs for us. We started with what we had. We did the 5 first LGAs, school-based treatment. We trained school teachers to manage that because that was done at the schools. We then went on to do the remaining 6 LGAs. And then last year, we decided to do community-based, treating all the 4 diseases that are endemic here. Schistosomiasis, bilharzia, lymphatic filariasis, elephantiasis, drugs for elephantiasis, soil-transmitted ailments, intestinal worms, and onchocerciasis, river blindness. And last year, we successfully, in collaboration with the Primary Healthcare Development Agency, moved around the entire Gombe State treating every eligible child and adult. And right now, Your Excellency, we have trained since we came, we have trained we trained all the state team, 6 of them. We have trained 55 LGA coordinators and NOCTs. We've trained them severally because we've done that a couple of times. We have trained 3,572 teachers. We have trained 4,322 CDDs because the community treatment system, you have to use community volunteers. And we succeeded in treating school-age children with praziquantel to prevent schistosomiasis, bilharzia, and we did treat 6,304,998. And then we treated 2,078,714 against onchocerciasis, river blindness. We treated 1,843,993 against elephantiasis. And with the help of the End Fund, we produced 17,654 registers. Because, Your Excellency, the way the program runs, you must have a register for every CDD. As they go from house to house, they have to enter the names of the people in the house, and the treatment must be recorded. That is what we collate at the end of the day, that we must be set. We collate, have the full record, we report to the Federal Ministry of Health. And that's the way we can know how many people we are treating each time. And also with the support of the End Fund, we have a HELOX to enable us move around for supervision. We also bought 11 motorbikes for each LGA team, the LGA coordinator, because we know we cannot ask them to supervise. The LGA is so big without giving them mobility. We give them the motorbike during the period of the treatment, and we give them funds for fueling. Your Excellency, there is so much related to the NTDs. It's not just a matter of treating. We can go on treating year-round. We know that there is issue. These diseases are caused by people getting contaminated with bad water, with contaminated water, like the ponds where the chisto thrives. And so there is a need for hygiene, there is a need for good water. And I want to say, Your Excellency, that you are doing creditably well. Because in the 13 years that I have been running AME Foundation, we've supported 10 states in this country. And when I travel around, I've never seen any state with good roads like Gombe. We travel, we go to Nafada, we go to Funatai, we go Kumo, everywhere we go, we are able to reach there. So, Your Excellency, all you need to do is just add a little bit more, just the icing. It's only the icing, you already baked the cake. And we know that you are able, because you are a prudent person. Of course, as a former Accountant General, you know how to use funds. So we are very happy to be here, Your Excellency. And I want to assure you that AME Foundation, though we were sponsored by the End Fund to come here for NTDs, we felt that those things we've been doing well in other places, we should not leave them behind. We must come here also with them, because they are needed by the people of Gombe State. As we are speaking right now, Your Excellency, from yesterday and today, we've been training 17 health workers in Pindiga, at the Cottage Hospital Pindiga, to manage lymphedema. Those people that have elephantiasis, who cannot move, who may have more complications. We are training people from 3 LGAs, Akko, Shombon, Biliri. They are right there now training and treating people with lymphedema. So that, and I told those who, their supervisors, not to nominate anyone that is not willing to do home care. We have to begin to do home care for our people who cannot go to hospital. And so those who cannot go to hospital for one reason or the other, those health workers will be sent to go to their homes to support them. Then secondly, Your Excellency, right now we have 4,000 glasses in Gombe. We have ordered another 16,000 to make it 20. We want to start with the 4. Tomorrow and day after, we are going to be doing eye care, distributing free glasses, and then we are looking out for those who have tracheasis. The 5 major diseases that the End Fund is tackling are bilharzia, elephantiasis, river blindness, schizophreniasis, soil-transmitted helminths, and trachoma. In Gombe, we are no more treating people for trachoma, but there are people who suffered from trachoma years back who are blind today. The Federal Ministry of Health has over 19,000 that are blind. I said to them, where can we find them? They said, you have to do outreach. So the outreach tomorrow is being supported by the End Fund in collaboration with my foundation and your government. We put it clearly that this is in collaboration with Gombe State government. We are going to be giving out glasses. We are going to be enlisting those who have tracheasis and cataract, so that we can arrange surgeries for them as soon as possible. And Your Excellency, I want to use this opportunity to thank your commissioners, particularly the Commissioner for Health, the Commissioner for Economic Planning, and the Executive Secretary of the Primary Healthcare Agency. I have not seen you until now, but we have worked seamlessly. We have received support. We've been able to achieve a lot. This is because your commissioners have stood by us. Whatever we need, once I call them, they respond instantly. And I want to thank you, and I think this is also due to your good governance, because it's only a good head that can have good subordinates. It shows good management. So Your Excellency, tomorrow and day after, at the Hassan Central Primary School, we are going to be distributing 4,000 glasses to start with. And then before that is exhausted, we've ordered for more that will arrive. And we want to go from one local government to the other. Because if you want to do a program, make sure it reaches everybody. We cannot stay in the capital. We are going to go from one local government to the other. And I think at this point, Your Excellency, I need to mention that AME Foundation is working with so many ministries, not only primary healthcare and the Ministry of Health. We are also working with Ministry of Information, Ministry of Economic Planning, Ministry of Water Resources, Environment, Education, SUBEC, and they are all seated here. We go to the fields together because we think that this is a problem that we all must tackle together. There is the environment aspect, there is the water aspect, and we must all work together, we must all reason together to achieve a success. And Your Excellency, I want to also inform you that we are going to be doing the cataract surgeries and tracheasis surgeries as soon as possible. The ministry, the specialist hospital, through the gracious approval of the Ministry of Health, is working with us. And the FCM Federal Medical Center staff, surprisingly, said they are willing to come. Anything for the people of Gombe, they will assist. So we are going to have a lot of doctors and nurses there tomorrow and day after. And Your Excellency, I want to assure you that AME Foundation is a serious foundation. After retirement, I should be sleeping in my house, but I felt that there is a need, and I'm here in Gombe. I'm not here to joke. I don't have a friend here. I've only developed friends after I came, but I'm here seriously for business, and we need your support. Because with your support, we can do much more. And then, Your Excellency, talking about, I told you I started with general medical care. On the 3rd of September, an expert in diabetes and hypertension, somebody, Dr. Peter Amy, who has 27 years experience in the management of diabetes and hypertension, came from the UK, and we had a very good workshop with the Ministry of Health. The Commissioner for Health was there personally, the Director for Hospital Services was there, the doctors from all the specialists, general and cottage hospitals were there. And for a whole day we brainstormed, and we said, Why is it that people who are diabetic in the UK, in the US don't have amputation? Why is it that they are not doing kidney transplants the way we are doing here? Look at the amount of money we are spending on kidney transplants, whereas this can be prevented if we nip it in the bud. What shall we do? And we sat there, we talked frankly, and we identified some of the things we need to do in Gombe State. We're not looking for what is happening in UK or US or FMH. We are looking for a homegrown approach that is workable in Gombe. And Your Excellency, through the Commissioner for Health, we will feed you back on what we've decided to do. We've identified some weaknesses in the system. We've identified a few things we need to do, and we have said we have to start from what we can do. Then the bigger ones we can now escalate to His Excellency. First of all, if a patient comes into your hospital and you don't open a register, next time he comes, how do you manage him? How do you know his status? Then secondly, if a person has a stroke and goes to a health center, who is there to manage? Who is there to manage that person? That is a critical situation. And so, Your Excellency, we are going to work with you, with your government, to ensure that the health status of this state improves. I'm glad to tell you that my 31 years in WHO is not in vain. I enjoy a lot of goodwill, and people are willing. They say they will come to Gombe State. I should just tell them what we need here. All we need, Your Excellency, is your support. Thank you so much, sir.
Indeed, Your Excellency, like she said, a very long story, but I must say a very passionate and inspiring one. If somebody is very passionate about a cause, it is always very easy to want to say it all, and especially when they tell them that if you see the governor, say all you want to say because you do not have the chance of seeing him again. So I believe, Your Excellency, you very well understand with piety for taking all the time to say what is on our mind. Yes. And may I have the pleasure and honor of inviting His Excellency, the Executive Governor, to respond to some of the issues that have been raised in her speech. Your Excellency, sir.
Thank you. Your Excellency, the Deputy Governor, Your Excellencies, members of the State Executive Council, your President, the Head of Service, the Acting Executive, the Chief of Staff, Permanent Secretaries, other government dignitaries here, the CEOs of AIM-Fund and Army Foundation and members of your team, other invited guests, gentlemen of the press, ladies and gentlemen. Let me first and foremost apologize that you have not seen me for a very long time. But I think I remember I saw you somewhere.
Yes, May 11.
And as a negotiator, you can trust where I met. Let me use this opportunity to welcome you formally. I know you have been welcome on my behalf from the airport to where you're supposed to stay and to the government house, but officially I'm welcoming you on behalf of myself, the government and the people of Gombe State to Gombe. And to add by thanking you most sincerely for taking the risk and your time. I don't know how you managed to come AIM-Fund, because when you look through the website of Nigeria, and you say you are coming to Gombe State, which is located in the northeast, I don't know which kind of color is painted. It's as good as you are going to Iraq, or you are going to Syria, or you are... So for you to develop interest and come here, we sincerely appreciate you. Especially the fact that you don't even need to come, since you have local chapters that can organize all your programs and projects in delivering and sustaining lives, and humanity. Like you said, I truly believe, and I know, the purpose of this life, really, is not to wake up in the morning, go to the office at 8 o'clock, close at 9 o'clock, then do that for 35 years, or when you are 60, when you cannot be useful to even yourself, and then you retire. I'm sure that is not why God created us. I'm so sure about that. I'm sure we are supposed to do more than that. And I'm sure what we are supposed to do is to be more responsive to our communities, to cater for our people, and to treat or sacrifice a lot of our part of life for humanity. So for you who have chosen to be in this field, in the villages, in rural areas, in all the nook and corners of the world, I salute your courage. Because it takes a very courageous person to take this kind of decision. And I always tell our people, I work in the civil service too. By the time you retire at 60, because you are so used to routine things, you wake up in the morning, you go to the office, you come back, you go. The day you retire, 2 months, if you don't have blood pressure, you develop one. Another 1 month, if you don't have hypertension, you get that one. Another 1 month, if you don't even have, I don't know the medical terms for river blindness, you start to see dim in your eyes. Because you don't have friends, you don't associate, you don't do anything, you don't even think about anything. You live a very straightforward life, you receive salary, go to the market, take care of yourself and the family. And you think that is the end of life. That is not the purpose of life, I thought. We must all make outreach to our various communities and pay back what we are supposed to pay in our own ways. All these people, N-Fan is doing it. N-Fan is doing it not because she has a lot of money, but she can make 2 or 3 more sacrifices, sourcing the funding herself or themselves, putting together a structure that will coordinate a well-meaning delivery and deliverables, and also coordinating people that you will support, so that overall everybody is happy with one another. And we always say we should be just, we should be fair and equitable. We cannot be just fair and equitable when somebody is blind and does see. We cannot be just fair and equitable when somebody can walk because of simple disease that his leg is fat, that he cannot carry the leg up and down because of a bite or mosquito or something or one transmittable thing or the other. So I plead with all of us that after some time we should join this one. Don't be planning that after this one you go into politics. Politics is a game by the side. It happens sometimes, it doesn't happen. And you are only a true politician when it is happening today and next tomorrow it doesn't happen. So when it doesn't happen, you plan for what you do. When it doesn't happen, I mean when you don't win election. You are a good politician when you win sometimes and you lose sometimes. For me that has won now, maybe I'll decide to just step aside and wait for some time. If you don't take care and plan for what you are going to do, or you don't take this as an hobby, you take it as a full-time job, then there's a problem that is bound to happen today, tomorrow, or next tomorrow. I want to salute you too, because by our location in Gombe, we are bound to face a lot of health challenges. Number one, we are located in a mountainous area in some part of Gombe State, where to get access to certain places in Gombe State is very difficult. I know you will be visiting one area where we treated bilharzia some 3, 4, 5 years ago. The bilharzia has climbed the hill now across to the other side. And I received reports, domesticated. And they also use the snakes to produce anti-snake venom, which we buy now. We buy from Cuba, we buy from some other locations to treat this kind of people. And also they say after some time, not man or woman, after 60, there is always a kind of support that they give men. That kind of support is also obtainable from the snake venom. You know, it's the most popular drug now around the world. Whether you understand? I have an idea. So I don't want to tell you to go and kill all the snakes. But you should also support that snake bite facility that we have before the bigger one for the purpose of saving lives. And I want to tell you that most of the beneficiaries from our statistics, less than 5% are from Gombe State. We have more people from the Cameroon, from Chad, from other insects neglected to and end it.
Yes.
You know, and if it's not part of your program, it's good to get it into your program to save lives and to support people who require to be supported. Also, we are in a location where in some places in Gombe, you cannot get water 300 meters down. So we have to reserve or dam water, treat water, transport water, and then distribute it. To the extent we do also depend on us for the work that you are doing in Gombe. And I have not seen you, but I have been receiving feedback on whatever is happening. And like we said, if you have to see me for any kind of thing you will do in Gombe, you will find out that you cannot do anything. So it's good for you to do your program. And my own case, I only say yes or no. And since you are here and they allow you to do your work, that means I've already said yes. So I want to assure you that you have our support and we will continue to support. But if there are specific areas you want us to collaborate or the kind of support that you need from us too, you should say them in a clear terms, in a clear way that we will go straight to the point and do this very important assignment. Counterpart funding we will provide. I think we have provided for one of them. We have supported some. And then we will continue to provide for the other ones.
We have not received, sir.
You have not received it? You will receive by next week. Now that